Hey everybody, I threw together a PowerPoint that will go through and kind of show you, I guess it's the next best thing to actually getting your hands on some of the tools to explain some of these in a little more depth than what they were talked about in this week's lesson. Some of these are terms that you'll come across quite a bit. Obviously, rating scales, any of those, Itters, Eckers, Vickers, Sakers, are all related to our QRIS, Quality Rating Improvement System in North Carolina. And that's probably, it looked like from your surveys too, the one that most of you were most familiar with or even had access to. But outside of that, I don't think many of us have a lot of these laying around. So I wanted to pull together some things that I have to give you kind of an up-close look at what these look like and what they're meant to assess. The first thing that I have to do here is provide an overview of why we have them. So if you think back historically, let's say, I don't know, back in the 80s, you've got some folks providing child care, and you might throw everybody in the back of a station wagon or take a walk up the street and somebody gets bitten by a dog, and suddenly you have a rule in place around being able to take children out of the home. And then you've got another rule in place, whether it's car seats or how many children can be transported. All of these things began out of the need for providing some clarity around how to keep children safe. But as time went on, we started learning more about child development. So all of these theorists that we've talked about, you've got Vygotsky, Bronfenbrenner, whose picture or format is kind of what I used as my explanation here of tools and why we have them. All of this knowledge that we've got about child development, we start seeing, hey, there's some things in common that when they're happening in both of these situations, the child outcomes are better. And as we start learning about those things, we want to know more about it. So you've got research involved. And the only way that you can objectively look at something is to have an indicator or a statement that is written the exact same way and interpreted the same way in order to get an objective measure in two different places. So what I mean by that is that's basically the reason that we have tools that exist. So things like the rating scales. We want to look at what a child experiences in North Carolina. We also want to know what a child experiences in California without having some sort of objective tool that's based on solid statements that are concrete and observers being trained in the same way to interpret things the same way. We wouldn't be able to go do that. We wouldn't be comparing apples to apples. And that's how you've got tools that come along, and I clump them in what I call how they look at the child's experience. Now, that whole set of tools, the rating scales, are a program evaluation. They're looking at the entire program. But at the end of the day, it's giving you a snapshot around what does the child experience. Now, we started finding some funny things though. So we would see results that look differently in, let's say, two different classrooms, but we look and we notice that the teachers have the same exact education, let's even say the same 4-year degree from the same university, but the quality experience in those classrooms is completely different. And that causes us to say why. So the next thing we have to do is look at what does the teacher experience. Why is the quality in those sittings different if they've had some of the same pre-service experiences? And that's where your tools come into play that just look at the teacher's perception. This will go into those a little bit more, but that covers things like the TSI or the Teacher Satisfaction Inventory, the Sequel, the Equus. They're basically surveys that all ask things like, do you have the supports you need to effectively do your job? Do you understand the program's mission, vision, and values? Do you feel compensation is fair? Is there a path for career development? How much input do you have into decision making? Well, we start having these tools that are asking the same questions, and it's starting to highlight where some of those differences are and that quality at the bottom of what the child experiences. So based on that information, we then have to say, well, what does this mean at higher levels? What is happening at the program level that makes this look a little different? And when we get into the administrative piece is when we start having tools like your PASS, or your Program Administration Scale, or the BASS, Business Administration Scale, that are meant to look at program management. Now, granted, they both say leadership as well, but neither of the tools that I just mentioned, the PASS or the BASS, actually tell you how to be a leader. It's all about the interpretation and the approach, and I'll explain a little bit about that more in a second. But at the same time, we started seeing that, let's say through the lens of the PASS, which looks at program administrative practices, that even though these two programs may be doing the same thing in two different places, the outcomes are looking a little different. And that's where we have to take into account the outside systems. We all are in a system. We're all in different systems. Each program is in a neighborhood, and the needs in your neighborhood and the needs of your family are a system itself, or your families that you serve. But you're also inside of the early childhood system in North Carolina. You're also interacting within the division system with your consultant. You're inside of the health and sanitation system with your sanitation consultant. And you've got other systems too. Just the public perception of early childhood educators is a system that you have to interact within. And all of those things affect these different layers. So I want to highlight here this piece around choice and how you approach things. So if we go back to that administrative layer and we think about something like lesson plans. So your consultant wants to see that lesson plans are posted on the wall. And you are going into the classroom and you're seeing that they're not up to date. You've got something on the wall that's from like 4 weeks ago. And you approach that staff member and you ask them about it. Why are these lesson plans not up to date? What's going on? You've got planning time. Well, the staff member says, yeah, I do, and it's at nap, and I have 2 kids that never sleep, so I've got to keep up with them. And then we've got John, who needs to have his back padded for a while, so I'm padding backs, I'm reading a quiet book to Sue, and the timing never works out, so my lesson plans are really behind. Your response to that is, well, they need to be done. You've got planning time. Well, down here we move into that staff experience and teacher experience. How does that make the teacher feel? Through the lens of, let's say, a satisfaction inventory or survey, they're going to kind of feel defeated. That planning time might be set up right now to happen at nap, but it's not working. They're feeling the pressure of needing to have this on the wall, but they're also torn to meet the expectations that the children have of them to be a caregiver and a lover and a supporter and a nurturing person. And that sometimes means it has to happen at nap too. So then at the end of the day, let's move down to the child experience. Through the lens of something like the Eckers, this could potentially show up as a long time spent waiting. Things aren't planned very well. Things are going off the cuff for the teacher. It's showing up in that area. It could also show up as in your centers aren't very well developed, and it's because the teacher hasn't had the time to put into the planning. So if we look at it just from, let's say, a rating scale score, and those things come back on your report, we go to the teacher oftentimes and we approach them with, why is this happening? But here I've tried to explain to you, there's a bigger picture. And part of that circles all the way back around to your choices and what planning time looks like and how that's approached with the teacher and how at the end of the day that choice affected the teacher's experience and the child experience and how it showed up the way it may have on a rating scale. I just kind of wanted to give this overview because we tend to compartmentalize each of these pieces of assessment, and we also tend to link rating scales to a teacher's performance. But what I'm trying to do is break down that perception with you that it's actually a program level tool. And if you look back to the root of the problem and not just the symptom, you can trace it all the way back up to where we have a choice that we can shift things and be more proactive in creating a work environment that supports the teacher, gives teachers more satisfied perceptions of their work, and in turn is going to increase the quality of what the child experiences. So I'm going to take you through just an overview of a couple of tools. I realized I left my, what do I have here? Vickers. I left my Eckers at the office, but this is just the cover of 2 of them. There's also the school age scale. And I gave a snapshot here of just one single snippet of what this tool is looking at. And typically on tools, you'll find that they progress from minimal to kind of medium, okay levels, and then at the higher end, you're seeing the highest quality. If you look at this at the 1 level, which is considered minimal, you're seeing things around, there's little to no talking to infants and toddlers. This is from the ITERS, by the way. Constant noise is interfering. A lot of times you can go in a classroom and infant classrooms, and if it's not enough teachers for the number of children and we can't meet all the needs, you're going to hear a lot of crying, staff talking in unpleasant manners. So that would be things like it says here, negative tone of voice, threats, statements that are negative. But then if you move up to the kind of medium levels, you're seeing more things around language, which are that, hey, it's quiet enough, we can hear each other. Staff are using a neutral or pleasant tone of voice. And at that indicator, at the 3.3, I'm going to point out that little asterisk. Whenever you see that in a tool, it usually means that there's an additional note or something that will clarify what that means. And I've written, because this is mine that I use so that I don't forget, I have lots of notes in mine. This means you can hear 2 negatives before you have to not give credit for this indicator. Negatives meaning that negative tone of voice, statement, that kind of thing. They can get away with 2 at this level. And the content of the talk here is generally encouraging, positive. 75% of the time is actually what that little asterisk is referring to there. The higher you go in this one single item is you're seeing that the caregivers are talking to the children. And really what this is coming down to is, at the end of the day, what is that caregiver doing to interact with the child? And we know the importance of language development and relationships as being basically the curriculum for infants and toddlers. If you have nothing else in an infant classroom, you need language and you need some love and safety and reassurance to build that attachment. So that's really all this one is looking for. This one is from the Family Child Care Rating Scale, and I just took a snippet of meals and snacks, and it goes everywhere from not following sanitary procedures at a minimal level. Meals and snacks are not appropriate. Children are having to wait even if they are hungry. That's minimal. If you have a child in your care and they're hungry, feed them. Moving up the scale, it's going all the way to menus being provided. Meals and snacks are relaxed and pleasant. The provider is sitting with the children. Are they having conversation together? These times are well organized. The children are not having to wait for 45 minutes for the caregiver to go put lunch together, that kind of thing. Just wanted to give some of you an overview that are new to these tools, a lens of kind of what they're looking at. Another one that's looking at the child experience is the class and tool, and there's a few of these. infant, toddler, and pre-K are the ones that I work with most closely. I am a certified toddler and pre-K observer. And these, when they're done to fidelity, are meant to be done in cycles. So you will observe for 20 minutes, you'll make notes, and then for 10 minutes you score. At the end of this, you put your cycles together and you come up with some averages. But again, for the purposes of professional development and program planning, I don't want anyone to hyper-focus on a score, but so much as get an idea of what these look at. Now, while the rating scales to me include a lot of structural pieces like materials, sanitation, you've got the hand washing, things like that, your class tools to me, I call the fluffy tools. These are really looking more at interaction, language, relationships, and how teachers teach. So what does that curriculum look like in action? And when I say curriculum, the class tool doesn't look at the name or the framework of your curriculum so much as it looks at how does this teacher work with concept development? What does the teacher build on? What strategies does he or she use? What kinds of language and opportunities to use language are happening in this classroom? What does productivity look like? Is the use of time maximized? Could you squeeze in another moment into this instructional day? Is there time spent waiting? All of those pieces are basically, to me, the focus of the class tools. The Rosie is more towards, well, this includes outdoor pieces, but from the perspective of what makes an environment inviting. So this is around the child experience too. Now, I gave a snapshot of 2 of these just so you can get an idea of what it's looking at. Again, this is one of those that goes from the lower to the medium to the higher practice kind of school of thought. So at your low end, when you look at furnishings in the space, it's saying most classroom furniture and equipment have been purchased from an early childhood supplier. I have a feeling that they are trying to say Kaplan without saying Kaplan. And I want to ask you, why is that considered minimal? I just want you to think about it. My answer for this is that they are assuming when we do that and we purchase these big old things in bulk and we get all this stuff from Kaplan and every classroom is cookie cutter, what thought have we really put into the early childhood environment? Are we bringing in real things from the child's life? So then move up that scale. And at number 2, it says at least 2 small authentic items have been added to each learning center. Tool belts, teapots, telephones, road maps. These are real things. They're not saying imitation things made of plastic or a child's toy, but real stuff from your house. And I want to ask you again, think about it. Why would they be saying that this is a little bit better? And then at the highest level, of course, it's saying that most of the things in the classroom are real authentic items and pieces of true furniture. Like you could go to Goodwill and rack up and be at the high end on this tool. On the one that's in red, I wanted to look at 2, let me find it. No more than 3 commercially prepared materials are displayed. No commercially prepared materials are displayed. Supporting elements of displays. This one was referring to things like bulletin boards and the pictures that you can purchase for looking like you have diverse families posted in your classroom. They're commercially purchased and prepared. And what is the difference in that between all of your displays actually being child created? The lens that the Rosie is looking through is really how to bring real life into the classroom. Now, this is where I want to highlight again, you have a choice, and it's based on your values. If this is not something that meets your values and you have other things that come first, there is no reason that anyone should pick up this tool and judge themselves on it or feel that they have to do something if it doesn't meet with what they believe about children. You'll find that coming up again and again. Now, another one is the poems, the preschool outdoor environment measurement scale. This one has to do with your outdoor learning environment, but what I love about it is that it also brings the teacher interaction piece into play. So there are some items that are just looking at the outdoor environment as far as materials and stuff, but then there are some that directly include the teacher and what the teacher's role looks like here. Now, I know you can't, some of the writing on these is not that great because I took pictures and was trying to blow things up, but you'll see that it moves to children are approaching the teacher and caregiver with questions, seeking support. The next step up is that the teacher or caregiver is encouraging or facilitating a small group activity. You don't always see this happen outdoors. For some reason, we walk outside and the teachers go into their moment of talking time or sitting time. Moving up the scale, teacher or the caregiver uses open-ended questions to build on their interests outside. And then again, this is an interesting one to me too. The teacher or caregiver does not let personal fears of wildlife or nature influence the children negatively. This is an example of being outside and you might see a teacher, oh my gosh, a spider, and they squash it. So I want you to all take all of these indicators that you come across in tools, and I want you to ask yourself, does this align with my values? Does this even matter to me? And also, even if it doesn't matter to you or align with your values, why would someone consider this important? Well, the argument behind that is that if young children are around adults who continuously squash bugs all day, what kind of approach are we instilling in them to exploring nature? Well, if you want to think about behaviorist theories, some of you talked about Bandura and modeling what behaviors you see. There's one thing that would be a direct effect, but also what kind of behavior are you modeling? Are you digging in the sand with them? Are you talking about exploring in the dirt? What kind of things live in the dirt? Oh, look, we found a roly-poly bug. Let's touch it. Versus, oh, don't go digging in there. There's icky, gooey, weird bugs. It's really just about what are you imprinting on that child? But this tool looks at that through the lens of what is happening outside. Now, I want you to move up to that next layer in that model I shared with you that looks kind of like Bronfenbrenner's socio-ecological model. You looked at some tools that were around the child's experience. There are some that are made for the teacher experience, and I've shared with one of those with you here, and I use this one all the time in my work. This is the short version of what we call the EQUIS, or the Early Childhood Work Environment Survey. What I do when I work with programs with this tool, I have turned this into an online survey format so I can distribute it through the internet. Staff will fill it out, and then I take the results and aggregate them into some charts and graphs. So basically I'll have one that is a graph, and it'll say, I don't know, let's look at the very first one. 20% say always staff are friendly and trust one another. 80% say seldom. Well, I start putting these together in ways that make sense, and I then do a staff meeting to facilitate everybody talking through these. And at the end of it, we try to have at least 3 or 4 actionable items that they would like to work collectively together on and take that back to administration to work collectively together on. For example, something that could come out of this is the center provides guidance for professional advancement. If everybody says no, and we start talking through that together with the staff, and I highlight that as a potential thing that we could try to do. So would it be safe to say you would like for administration to work with you to provide better guidance for professional advancement If the staff say yes, we move on with that as an actionable item for future work, all together collectively to figure out what we could be doing that we aren't doing. The reason for this is because teacher experiences and their perceptions directly affect what happens in a classroom. If everybody feels undervalued, that their opinions don't matter, that trust levels are low, morale is low, what do you think that teacher is going to be able to emotionally provide to the children in the classroom? And what kind of commitment level does she even have, he or she has, to the facility? There are many ways that you can use this, though. You could do this yourself on paper, anonymously. You can have somebody come in as a third party to do this. If this is something that you're interested in doing, I highly believe that a best practice would be checking in on a lot of these things, if not all of them, with staff frequently, at least annually. The reason for that is that you can be doing something all day long and you think it's working, and if no one else thinks it's working and they're not telling you, you can be trying to put out fires that aren't the actual fire. It's like the root of the problem versus the symptom. The last two I've thrown in here are around the business administration scale and the program administration scale. These are two that I got hung up there for a second. The program administration scale is the sister to the BAS that we just looked at. This one is for center directors and administrators in child care programs. It covers topics, everything from parent-provider communications. I've listed some of those there. This one too, I left my copy in the office. I am a certified program administration scale assessor. And this is one of those that was about a week's worth of training and 4 different tests in order to be certified. This tool is used in a couple of states' QRIS. So not only do they go through the rating scale assessment, but they have an assessor that comes and goes through this tool as well. And let me tell you, this is not one that I would want to do all of the time as a job. It's extremely detailed. It's very thorough. But then at the end, everything that you are saying verbally you're doing, the assessor needs to see documentation to prove it. Why is that important? Because I can sit here all day long and tell you that my staff get paid planning time once a week together for an hour. And I can tell you that all staff receive 10 vacation days in their first year. But unless I have something on paper somewhere that proves that's really happening, it's all talk. So this one begins with an interview process, and begins with an interview and it ends with documentation. But again, this is one of the best tools I will ever recommend to you in this line of work to keep on your shelf, pull it out, and just look at it, and it's all rated in yeses and nos. So every single indicator in this tool you can look at and say, yes, I'm doing this, or no, I'm not. But it gives you a great overview of what best practices are in relationship to administrative work. Again, I want to highlight, though, that all of these tools need to come with your lens of why is this indicator important, or why would somebody even put this in a tool? What is the benefit for me, for staff, or for children as to why somebody thinks it should be in the tool? Why is it here? And then I also want you to ask, does this matter to me, or am I even capable of doing it? And I say that because I shared an example here of one indicator that's in the past, and it's the last one, the paid planning time one. I don't know a lot of programs that actually can do this. I work with a ton of programs, and there's very few that could make this indicator happen. Does that mean that you are not doing the best you can with what you have where you are? Not at all. So that's where I want to say there are choices that you can make. You can always make things a little bit better than they are, but you can't always do everything a tool has as a best practice just because of the reality of the context of the program, the staffing, finances, all of those pieces come into play, and your values. Another piece of this too is that tools don't really have anything to do with state regulations. So you may find things in a tool that the numbers are a little different. Like the PASS, for example, there's one in there about there's a policy in place that all staff have a minimum of, 20 clock hours per year. Well, we know that that's not what the division says in North Carolina, but that's just another choice. Why would you maybe want to have that as a policy? Well, maybe you believe that the more professional development experiences your staff has, the more effective they'll be in a classroom. So always keep that lens of, why did they have this here? Is it important? Does it align with my values? And even if I wanted to, can I do it? And if the answer is no, and you want to do it, find a way to step towards the goal. You don't have to always meet a goal word for word, so much as understanding that change is possible and figuring out collectively with staff, families, children, whoever is involved, how to do that in the best way possible to meet the needs of everybody involved. If y'all have any questions, don't hesitate to reach out. And I hope that gave you a little bit of a taste of some of the tools that are out there and the things that they are looking for, and how to get your brain working when it comes to picking a tool up off the shelf and using it for the sake of program planning.